Destiny, thank you again so much for your time. If it's okay, I just want to move to the tobacco cessation part of our appointment.
Absolutely. It's one of the reasons I'm here.
Okay, so I just have a few questions to begin with, if that's okay with you.
Yep.
Okay. So do you currently smoke or use any other forms of tobacco?
Yes.
How long have you been smoking for?
I started when I was about 15 and I'm 34 now, so roughly 20 years.
Okay. And on average, how many cigarettes do you smoke per day?
Close to a pack a day, so about 20.
Okay. So as a future dental hygienist, I can tell you that the best thing you can do for your overall health and your oral health is quitting smoking. Are you aware of the connection between smoking and periodontal disease?
I know a little, but not much.
Would you be interested in learning about it a little further down the line?
Yeah.
Awesome. Have you ever been shown how to do an oral self-cancer screening?
No, not that I can remember.
And would you be interested in learning how to do one learning on?
Perfect.
Now, would you be interested in assistance or referrals to help you with quitting smoking?
Yes, absolutely. I've tried so many things in the past and it wasn't very successful.
So how many times have you tried quitting? If you don't mind me asking.
I've tried a couple times. I don't know. I've lost count, but I ended up smoke-free for about 8 months before relapsing. Then it went on for about 4 months again. Then I stopped for 2 weeks, on and off, on and off.
I can understand. Quitting smoking is one of the hardest addictions to overcome, so try not to be very hard on yourself. And the fact that you're here today talking about it, that shows a lot of determination. And many successful quitters don't really quit on their first attempt, right? It takes, I think, on average about 7 tries. So try not to be hard on yourself. You're on the right path.
Thank you.
Can you remember what was successful about that time that you quit over 4 months ago?
I don't even know. It was a while back.
Okay, maybe we can recircle to it later. Let's talk about the habit a bit more. Okay. How soon after waking up would you say you have your first cigarette?
About 30 minutes to an hour.
30 minutes to an hour. Okay. And do you eat anything before you smoke?
Not typically, no. I get very nauseous in the morning, so yeah, mostly don't.
Okay. And would you say that the nausea goes away after you have your smoke?
Actually, yeah, now that you say that, I think so. Most of the time, I always thought it was because the cigarettes kind of settled my stomach.
That's actually very common among long-term smokers. What often happens is that your body has become dependent on the nicotine. So when you go a few hours without the cigarettes, the nicotine level on your body decreases. So what you are experiencing is actually withdrawal symptoms, and it can vary from person to person. But you can experience, nausea, irritability, headaches, difficulty concentrating, and strong cravings. Does that sound familiar?
Yes, it does.
It sounds like smoking has become a part of your routine and your body has gotten used to it over the years.
Yes, yeah, definitely.
So besides the morning cigarette, would you say there are times or situations where you're most likely to smoke?
Well, while I'm drinking coffee, driving, when I'm stressed, work, yeah, it's pretty much everything.
It sounds like smoking has been linked to your everyday life activities.
Yeah, that's exactly it.
When you think about quitting, what would be the biggest benefit for you personally?
My health and, the money too.
Yeah, those are both excellent reasons. If we talk about just the financial aspect of smoking, have you ever calculated how much you spend on average?
No, I haven't done that. Probably should though.
Well, I guess it's painful to think about it, right? Because if you have roughly a pack a day, and if we say a pack of cigarettes is between $15 to $20, we're talking about a good few $100,000. Just a few $1,000, excuse me.
It's a lot.
Yeah, I get it. It can be painful. So besides your health and your finances, are there any other reasons why you would like to quit?
Well, I hate feeling dependent on it. I don't like that it controls me in my day-to-day life,
Yeah, absolutely. That sounds like a super powerful reason. Regaining control of oneself.
Yes.
So if I put it on a scale from 1 to 10, where 1 means you're not ready to quit and 10 means you're absolutely ready, where would you place yourself?
I'd say probably about an 8.
So why an 8 and not a 4?
Because I really want to quit. I just don't know if I can.
So your motivation is high, but your confidence is a little lower because of your previous attempts to quit. Would that sound accurate?
Yes, yeah.
That's understandable. Now, what do you think would help you place you from an 8 to a 9 or a 10?
Probably having a plan for the cravings next time.
Cravings, okay. So that's a great insight. Planning for cravings can make a huge difference. Earlier you mentioned that you were able to quit for 8 months. I know you said you didn't remember, but like if we dig a little deeper, what do you think that was different about back then that helped you stay smoke-free for 8 months?
The more I think about it, I was a bit more active. I was outdoors, a little bit less stressed at that point of my life.
Okay, that's interesting. So it sounds like being active and managing stress helped you in staying smoke-free.
Yeah, I think that did.
Do you think that you would be able to incorporate those habits right now?
I think so. I think that would help, yeah.
That's great. Remember that quitting smoking isn't just about removing the cigarettes, but it's also about replacing your smoking with healthier habits and changing your identity. Like instead of seeing yourself as a smoker, seeing yourself as I'm a healthy person or a smoke-free person.
Okay, yeah, that makes sense.
Now, would it be okay if I share some options with you about managing the cravings?
Yeah, absolutely.
Okay, so we can talk about several nicotine replacement therapies. And then I can also tell you the name of some medications, then you would be able to talk to your doctor about it. Okay, so firstly, for the nicotine replacement therapies, these are the ones that provide the nicotine without all those harmful chemicals that the cigarette contains, right? So the first one would be nicotine patches, which provide a steady amount of nicotine throughout the day, and you just place it like on your arm. Okay. Then you have the nicotine gum, which can help you manage cravings when they occur. The only downside of that is that it doesn't really taste awesome.
Yeah.
Then you also have the nicotine inhalers and nicotine mouth sprays, which I guess some people find very useful because it actually mimics the acts of smoking.
Okay. Yeah, I've tried patches and gum before, and yeah.
That's good to know because sometimes people need the way they succeed is by combining a bunch of therapies together.
Okay, yeah, I didn't know you could combine them.
Yeah, that's something that you can definitely talk with your physician or your pharmacist. So like I was saying, in addition to the nicotine replacement therapy, there are prescription medications. One of them is called varenicline, that is also known as Champix, and it works by reducing your cravings and making smoking less satisfying, if you will. Then another option is called bupropion, also known as Cybin, and this one helps with withdrawal symptoms and cravings. But again, for this, you would have to speak directly to your doctor.
Okay, yeah, I might have to look into that.
Yeah, I think it's something worth discussing with your health provider. Now, I would also like to provide you with some resources. This one right here is a pamphlet for the Smokers Helpline. They offer free counseling, quick plans, and other online resources.
Awesome, that sounds helpful.
Okay, and then the other one that I would give you this card. It's called Low Level Laser Therapy.
Okay.
They actually have offices in Woodbridge, and how they work, picture like acupuncture.
Yeah.
Okay, so instead of those needles, it's going to be a laser, and it's going to be targeted at specific points. And what it does is they stimulate your body to create its own endorphins.
Okay.
Right? So I think we're done for the day. I think you have an excellent goal going ahead, quitting smoking.
Yeah, thank you so much. Yeah, I hope so.
I just want to acknowledge the effort that you're putting into it, because quitting is not easy at all. And the fact that you've done it for 8 months just tell me that you can be successful once again.
Thank you so much.
Yeah, you're welcome. Now we'll continue to support you throughout the process, and maybe we can touch base again next time we see each other.
Awesome. Thank you so
thank
much.
you so much. Have a nice day. Bye.
Thanks. Bye.